next segment is very, very, very special because we're going to have Ms. Nell Choi here moderate a session about what it's like to grow up with NMOSD and MOGAD. Nell is 15 now. When I met her, she was 12. And she got NMO, as we established earlier, when she was 9 years old. She wrote her first book, and I say first because I suspect that she will have many more books in her lifetime, called My Hospital Story. And she wrote this book from her hospital bed. And then I discovered Nell on CBS Primetime News, and I was just casually watching, and all of a sudden I hear this sweet little girl talking about neuromyelitis optica, and immediately I had to find her. And here we are a few years later. She's now a junior ambassador for the foundation. She has given President Biden signed copies of her book. She won a Global Genes Award recently, a Rare Artist Award. She's an artist, she's an advocate, she's a writer, she's a student, she's a chef in the making. Please join me in welcoming Nell Choi for growing up with NMOSD and MOGAD.
Thank you so much, Tamara. That was a very lengthy and very wonderful introduction. Thank you. So I guess I would love to invite Dr. Ahsan, Dr. Graves, and Veronica and Elijah to the stage. Thank you. So you're probably seeing a lot of familiar faces here. So I don't know if we need to go into introductions, but I'm going to start off by asking a little bit about something we're probably all very familiar with as patients, the diagnostic odyssey. And for our two doctors here, I want to ask you about what is the typical length of diagnostic odysseys for pediatric patients, and how has that changed over the years? Because I know there's been a lot of progress in the past few years.
So I think there has been a lot of progress. One of my mentors, who had been one of the early pioneers in pediatric MS before we knew about NMOSD and MOGAD, had said that even in the early 2000s, trying to publish a paper on pediatric MS, your paper would be rejected because people didn't even believe there was pediatric MS. So that's just pediatric MS, for which we have even more information than we have for MOGAD or NMOSD. So fast forward 20 years, and now we do have stories where we get to the diagnosis within a week or so for these pediatric demyelinating diseases, and we can even have them treated within the first month. So that is not everybody's story. I still have referrals of people telling me, we talked about it earlier today in NMOSD, that vomiting episode, 8-year-old kid comes to the ER with vomiting. The first thing the doctor is going to think of is not going to be NMOSD. So there will be diagnostic delays because it gets written off as gastroenteritis or a stomach flu. So we still know there are odysseys out there, but it's remarkably improved over the last decade or two.
That's amazing to hear. And
I know I'll just chime into the same thing that definitely, as again, talking about the pediatric onset multiple sclerosis, which is of course quite very rare, only about 5 to 10% of the patients. So many times when a child is coming, especially majority of our patients are coming through the inpatient side from the hospital. That makes it a little easier because at that time we are able to do the diagnosis based on everything, specifically the MRI scans, overall the labs, the CSF, and that gives us better information. But on the other hand, you also have to think about that in a pediatric population, it's not just these neuroimmunology concerns, there are other conditions as well. Many things starting from thinking about prematurity, thinking about genetic conditions, metabolic conditions, mitochondrial disorders. So in pediatrics, I feel like there's a little bit this picture which muddies up this entire scenario. that you have to think about, not only just these big informations, but as well as other condition like nutritional issues, genetic disorders, leukodystrophies, right? So it's very important to keep an eye on, especially misdiagnosis. We don't want that. For a young child to commit them to a specific treatment, especially for a long time or for their life, I would say. So it would be very, very important and helpful to make sure that we are ruling out all the other possibilities and then making a confirmed diagnosis to the best of our abilities. But definitely you are right that yes, this is a really good time that now we are able to diagnose kids really with one MRI, especially with the changes in the diagnostic criteria and with the new McDonald criteria and everything. The diagnosis is easier, it's readily available. But there are still challenges, and we have seen some patients who come from outside or like even from some of our other patients that have been with us for some time, but the clarity wasn't there. So it takes time, but I still feel that now we are able to do a better job than previously.
That's really good to hear. And Elijah and Veronica, I wanted to ask you about what was that time like for you? I know you mentioned before it took you about a month or so before you got your diagnosis from when you started having symptoms. What was it like living in that uncertainty? And then when you got your diagnosis, what was that like?
Okay, for me, because my symptoms were I was sleeping for 21 hours a day, so throughout the majority of the process, I was sleeping. But when I was awake, I would kind of hear like the misdiagnosis, as in like I had narcolepsy or even like brain cancer, and then I'd just fall asleep and then kind of wake up, kind of like, oh, what's really going on? So that's basically it for me. I mean, yeah. And then for you, since you're
Well, when he first started having symptoms, he was sleeping. He would fall asleep eating. And I thought he was being lazy because he played like so much ball. And so I was like, we need to get him check his iron. The iron came out fine. And then he started asking me to read. He was in college doing summer school, so he would ask me to read his book for him because he said he was falling asleep. And I was like, maybe it's just boring. The book was boring. But I would read to him, and then I would be nudging him to wake up, and I just didn't. And then I took him car shopping, and he was asleep in the dealership, and I had to test drive for him. And my brother said, he should be excited getting a car. And my sister-in-law is a nurse, so she goes, well, maybe his sugar's low, give him Mountain Dew. So we're just having him drink Mountain Dew. And I ended up getting his car, and we drove straight to Valley Children's. And then that's when they did an MRI, and they told me that he had to go to the PICU because they were thinking maybe like a brain tumor. And that was just just kind of hit hard. And we ended up being there for 3 weeks, and the neurologist came in, and they told me he had narcolepsy, and I was like, that just doesn't seem right. So they were trying to send me home. My brother said, if you don't feel right, tell them that you want to stay until you get some more answers. So I told them, and then finally I told them, you know what, I'm just going to get a second opinion. So I started kind of researching neurology departments, and I saw that UCSF had a good one for children's, and so we ended up out there. They thought MS, and I think within 30 minutes of doing an assessment, the doctor goes, I don't think he has this, and they ran the test, and he ended up with anti-aquaporin 4. He's NMO positive, and he was also diagnosed with the anti-NMDAR encephalitis, which is, I guess, brain on fire. But the doctor did say he didn't present any symptoms from that. It was just from the NMO, and that the rituximab would, it was the medication for both. So.
And what was that moment like when you heard the diagnosis for the first time? I know
I cried.
At that time, there was very little information probably, and
Oh,
probably
yeah.
a lot of misinformation.
I Googled it just like anybody else would, and I just saw 5 years lifespan. And, I cried. I didn't, that's my baby. And so it was hard, but at the same time, one of the doctors mentioned about how it impacts the entire family, and it did, because I had my oldest son, because at the time we were going through church when all this was happening, and my oldest son started telling me, how are you praying to a God that is doing this to your son? How are you doing this? And I had him falling apart. He's telling me I had 2 more kids to think of. I'm at the hospital with him. It was just a lot for me. As I was, I'm a single parent, and so the impact was affecting everybody. My whole community came together, though. He was a big baseball player. He's well known in our community and the surrounding communities around, and they put together this prayer and worship out in center field. He played center field, so they put it out there on the baseball field, and that was the only time I left the hospital, to go out there and worship with everybody else. And I had, people messaging me on Facebook telling me that they hadn't even prayed in years until this happened to him. But it's because of him and the people that are drawn to him. But with the community and my family support, I think that's what helped. And we were blessed to have that with Dinuba.
That's beautiful. Thank you for sharing that. And I'm so glad you shared that, because it just really shows the importance of community and building that support system. I definitely want to touch back on that, but for Dr. Graves and son, I want to ask you about, how do you tell a young patient, about when they have this diagnosis? I remember when I first heard the words neuromyelitis optica spectrum disorder at age 9, I was really frightened, because it just sounded like foreign language. I didn't know what that meant. What would that mean for the rest of my life? So how do you explain it?
Yeah, no, I definitely hear that. So again, when in the pediatric, when I'm dealing with, it's not just the patient, it's the family, it's the parents and the grandparents, uncles, aunts, like it's the entire room is full of people, and there you are providing them with this information. So I try to use my language in such an easy words and something which is easily understandable to others. And also in some of the things are, of course, all of these words are so foreign to this person, right? The major impact out of that conversation is as to what does it mean to my child? Like what would be is there a treatment for this? That's their immediate question. What would be the outcome here? And I would say we are fortunate that we have a big team here, especially with the help of social workers, as well as some of our, in the pediatric, there's this life support. So this is a very big help that I would have at the hospital in order to provide them with this diagnosis. Plus, I also try to incorporate these, at least once a year, we try to have these patient day at the hospital, which are just at a very infant level, that we try to get them together into a certain time, and they would have availability, and different patients with similar diagnosis, we try to have them together and then discuss them as a group. But definitely I do hear that, and probably it gives me more perspective today, that thinking about this from the patient's end as well, and also from the family, which is another challenge. But with the help of course, not only just the support, but also our ancillary support is there, the child life plus the social worker, it makes more easier. And also as the parents and the patient, they are learning more about it, and I try to provide them with resources as much as possible so that they can get better information onto that.
Yeah, thank you for sharing that. That's really important. I wanted to kick it back to Elijah and Veronica. Elijah, when you had to transition out of your life from getting that diagnosis in the hospital back to outside world. What was that like for you? I mean, transition. This was probably around college time and everything. And I know personally when I transitioned back to school, it was definitely a challenge. And what were some of those most challenging times for you, would you say?
I would say to that, well, again, a big athlete, is if I could continue playing baseball. I did try to go back out there to, well, obviously play, but that was very tough because of my eyesight as well. And it got to the point where the coach was even saying, like, maybe you should just sit on the bench because it's too dangerous for you, you know? And just kind of going through that, like, really broke my heart because I kind of felt like baseball was who I was, you know? But then I kind of just accepted the fact that that's, well, not who I am anymore, but I did still try to stick with baseball, so I went into coaching, kind of staying around that as well. Kind of worked through that as well. And and I also do play adult softball, which is a lot easier because the ball is a lot bigger.
I bet you're really good at that.
And it's just tossing it up, you know. So so I do that as well. Yeah.
It's really amazing. I mean, I love hearing these stories about how you can turn your life around in these just little ways that you wouldn't expect before. And I think it's really amazing that you turned to coaching. That's just so admirable.
Yes, thank you.
For our doctors, I wanted to know, in transitioning back to school personally, I experienced a lot of learning differences that I hadn't experienced before. My processing speed was really affected. I'm not sure, Elijah, if you felt any of that either. But is this something you commonly see in patients where, you know, the ability to stay focused and in class and being just present is difficult?
Yeah, it's something that we try to anticipate for most kids with brain neuroinflammatory disorders, whether it be MOGAD or NMOSD or pediatric MS or the NMDA and encephalitis cases. So we try to anticipate it. We try to prepare families for the possibility of it. Doesn't always happen. So just because you have these disorders, sometimes everything is actually okay in this regard, but we try to prepare for it. There's different types of testing. There's neuropsychological testing that can be done that's age appropriate. Sometimes we need that assessment to get the school to do what they need to do. So we know it can be a burdensome type of testing. It's a couple of hours. For adults, it can be helpful for us to get folks back into work and sometimes get disability support if we need to, depending on what people do for a living. And for children, it can be helpful for us to communicate with the school. Most places in the country, we have school systems that will work with us. So often what we do on our multidisciplinary team on the pediatric side is we have our neuropsychologist and our social worker working with the physician, the nurse, and the family to try to come up with a plan for success in school. But I have to say that as challenging as it can be, we talk very frankly about our goals and what we're trying to achieve. And, I get lots of invitations to graduations and, get to get updated about admissions to college. So it is challenging, and we have to find the new normal. And for children, one of the biggest differences with brain disease is that we are not just trying to preserve what we have, which is often what we're doing with adults, but we are trying to meet where that kid was on their growth trajectory. The brain is growing during the time of this inflammation. And so we're trying to figure out how to get folks back on that growth curve in addition to holding on to cognitive function. So it takes a multidisciplinary effort between the medical team and the school system. So we keep people on track, but we advocate for people all the time. Need more time for tests? Easy enough. People say no. Then I step in and say why, and we battle with schools if we need to. Most of the time we win. Colleges are a different ball of wax, just because colleges are allowed to have very individualized approaches, particularly if they're private. But my experience is once we're good advocates for the patient, the colleges will work with us as well.
That's really good to hear. Yeah, we've had personal experiences with neuropsych and having to get the school on board with accommodations, and it's a whole big process, and it can be a little bit intimidating and daunting at times, but I'm glad to hear that we have the support of our doctors and specialists.
I think I'll just add to what Dr. Graves has been saying, and I think parents are going to be a big help in this because they are our team, and majority of the time we are taking care up until the hospital or to the clinic, but then eventually it's once you're out of the hospital, you are sometimes patients have felt like they are on their own. They don't have much support, but in that situation, definitely you are the one who is going to contact the school. We can help you with all the IEPs and individual education plans that you are going to discuss with your school and the counselor. We can definitely help with writing letters, and we can support you, advocate for, but definitely the parents are the one who have to stand up for their kids. And sometimes it's hard, but I think it's just a progression, and eventually you will see that, okay, things are falling into place. But I think, and this just gives me an idea that probably we should have another support team when the child is being discharged from the hospital, or like, you know, what else are the things to look into, or what else would be the possibilities to further discuss, because this is not the end, this is the beginning of another new situation. So I think that gives me another, and probably I'll discuss about this with my team. So thank you.
Thank you for that. And Elijah, I kind of wanted to ask this for you as well. Actually, almost like for me, looking into the future for myself, I guess. As a patient with NMO who's a little older than me, what was it like that transition into being kind of an adult on your own, managing your own care? What is that like? And I mean, I know I always hear my parents on my phone like yelling at insurance all the time. Like, is that something that you're like learning how to do on your own, making sure you get like your med shipments and staying on top of that? What's that like, really?
I say that's still in progress, you know? It's getting there, though.
I'm trying to teach him.
Yeah.
Yeah, and what's that like as a caregiver, too, to like send your son off on so...
Well, he stayed with his doctor until 21 in pediatrics. And so what I like to do with anything is I'll tell him, Google and research a doctor. I'll do the same, and we'll see if we come to kind of an agreement.
Yeah.
I love that. You guys are such a team. You know that. I also wanted to come back and touch on this idea that we talked about throughout the whole day of mental health. And I think that it's something that's often overlooked, especially, I mean, as a kid, as a teenager. I mean, come on, we've seen teens. Like, we've all been through those teenage years. They're rough, and it's an emotional roller coaster, really. I guess, Elijah, have you felt like you've had that support to get through things emotionally in your journey? And what is there anything that you would have had, like any support that you would have wanted during that time?
During that time, my mom was a big part of that. She stuck by me through it all, and I really do appreciate her for that. And then on top of that, I did have a great group of friends as well when I was able to get out of the hospital, that they will still come over to like my house, you know, and hang out with me for the day, even though I was still falling asleep. Oh yes, as well. I have a really good friend. He actually plays for the Atlanta Braves right now. Yes, he's a pitcher for them. And he actually, when he came down during like the off season, he came to my grandma's house and spent the whole day with me, which I thought was really, really cool of him. So yeah, that type of support.
What team does he play for?
The Atlanta Braves.
Okay, now I'm gonna root for that team just because you said that.
Oh yes.
I don't know anything about baseball, but now that you told me about him, I'm gonna start watching because he seems like a great guy. So.
He is. He's amazing.
And then for our doctors, personally, we didn't have our neurologists or doctors didn't really warn us about all of the emotional struggles that kind of came with this disease. And I personally would have loved a little bit more support with that. Do you provide your patients with support?
So often the way it works as a specialist in this area, sometimes I get to meet people while they're in the hospital, but often they've gone through some first phase of this, before they knew what was happening in the hospital, and then they come see me. I'm very keenly aware that that first interaction, either with a pediatric or adult patient, I do this for a living. I think about this disease day and night, but I know that I'm often the first person telling them this. So I try to be very conscientious in that first meeting of the significance of that first meeting. So I keep that in mind. The second thing I keep in mind is I always say in that very first visit, this might be tough. This might give you some emotional reaction. That's normal. There might be mental health issues, even if temporary, that I don't know that you're going to have mental health issues for a long period of time, but there might be an adjustment period. So I try to make it okay and seem okay if they start experiencing a reaction, whether it's depression or anxiety or just some sadness. We try to just put it on the table right away first visit. You might not want to talk to me about it right now. You might not want a therapist right now, but I'm telling you that it could happen. It's part of the natural part of living with this disease, so the door is open. Then we take it from there, and I let the patient lead as to whether or not we're going to tackle that now. The other thing I always do that I think my colleagues do, that we've all talked about before, is when we're starting at the beginning, we know that one visit isn't enough. We know that the first visit really is a first few months of living with the disease. So we try to set up, whether it's with me or with other members of the care team, lots of touch points up front, so that if this stuff emerges in the first few months, we're ready to take it, and we're ready to treat it if it happens. Also, have you all heard that there's data that when you go to a doctor's appointment, even if you're a doctor going to a doctor's appointment, the data shows that we only retain maximal 30% of whatever happens in that visit. So I tell people that. I tell people even when I'm a doctor going as a patient that we're just humans. When we're receiving news like this, we know we're not going to retain it all. So we try to set up a system to reinforce information, reinforce that there's resources and written documentation, and then we bring you back 6 weeks later to say, okay, now you've had time to digest. Now where are you at? Now what are your questions? And mental health is usually a big part of that second visit. It's like, okay, now I've got it. The shock's over. I'm ready to process. Now tell me what my resources are that I can go get help.
It's a really well thought out process, and I'm really glad that's put into place. And I really resonate with that 30% thing, because after a long visit, I am so out of it. I probably don't remember much.
I'll just add to one thing. Some of my patients, I've seen that they're doing a good job with bringing. They either would bring a family member or another friend or somebody who might be able to take notes for them, so that's very helpful. Or sometimes they even record the visit, so they can just review it later on. But having another person outside the immediate family is really helpful, so somebody would be able to listen a little bit more, pay attention, because the patient or the parents themselves might be going under that emotional upheaval that, oh, so much of information, so much to look forward to. So that's always just an additional help if you have another person who can come with you to the visits.
And just going off of that, what advice would you as doctors give to patients and their caregivers as to how to be their best self-advocates?
So many of the things which we have been noticing is especially that parents definitely, of course, everybody would want the best for the patient and the parent and the child. So in this way, I'm noticing that it's good to have a good team who can help support them in this time, and not only just the team from the physician's perspective, also the teams from the patient's side as well, such as the family members, or as you said, the church, or other friends, anybody who's close to you, or these groups like the advocacy groups like how we have here. I mean, today only in the afternoon, we were sitting on a table, and one family was able to connect to another person who's newly diagnosed, and they were able to share information, and it's so good and positive that you are in the same boat with someone else. You're not alone, and there are other people, they have gone through this, so hopefully things will be fine. So it's definitely a good idea. That's why I'm so appreciative that TSF is doing a good job and bringing people together and making a difference in their life. So Keep up the good work. Thank you.
And then this is just going to be to all of you. What advice would you give to newly diagnosed pediatric patients? We'll start with Veronica. Or caregivers, too.
What would I say? For newly diagnosed.
We can give you some time, too. If
Yeah.
Elijah, yeah, totally.
Same here.
Okay.
Okay,
Yes, over here.
I'll buy you some time. So my advice is to know that it can be overwhelming, that if it feels overwhelming, it's okay. That this, living with this disease, there are some urgent things. Sometimes we do really need to take care of something quickly, but that this is a marathon. This isn't a sprint. That it's okay, take your time to digest the information. Build up your team, your board of advisors for yourself. If you feel you need more than your primary neurologist input, build up your board of advisors, whether it's friends or other medical professionals. Realize, I think the difference for pediatric versus adult disease, when we diagnose it in adults, it affects the family as well, okay? If you are a parent living with one of these diseases, it affects your children, it affects your relationships, but the impact on the family and the family dynamic can be even stronger when we diagnose it in the pediatric setting. There are often other siblings, sometimes even other siblings with medical problems. There are things that the parents are going to have to juggle now that they have not been able to before, and it's a whole team effort when we diagnose the family. So I think acknowledging that, recognizing that, and taking care of yourselves. The caregiver taking care of themselves, taking care of their mental health. I think the one thing we forget sometimes is the mental health of the parents. It's not just the child. Sometimes the entire family dynamic has to be appreciated as well. And wellness. We are going to possibly recommend immunotherapies. We are going to possibly recommend lots of medical tests. But to keep at the center of it wellness, at some point in my career, I moved up. I always had a wellness section in my note, but I recently moved it up to the top. So instead of just talking about your labs and MRIs and things first, I've moved it up to the top. I say, how are you doing? Depression, anxiety, wellness, diet, sleep. I'm moving it up to the top just so that my patients know how important I think that is. That I am the prescriber of your immunotherapy, but I want you to know, I want to hear about your whole life as well. So this disease, as some other people said very eloquently earlier today, does not define you as a person. This is something that we're going to work together to take care of, but it is not becoming your identity.
Just want to add on to that. I feel like the doctors that really engage with you and like value you as a person, those interactions just, they make such a big difference. And I kind of wanted to add on to that, that whole stress piece. I noticed that for me, stress actually exacerbates my symptoms. And I think that, stress and bodily connection is really real. I have actually had those little pseudo flares kind of just where I have symptoms that I might think are a relapse, but they're really not, but they're just triggered by stress. So.
Okay,
Ready?
and I think I'm ready. I think what helped me was because I was such a big supporter on him, so I was always in the stands watching him play. So the only way that I can continue doing that was to do as much research or fundraising. I fundraised during his whole baseball career, and that's when I connected with Samira when she was looking for ambassadors. I was very, very, very new at it, so I was learning myself, but the more I learn, the more I can bring awareness, it would be beneficial for him, and at the same time would help both of us, because he would be able to connect with other patients and I with other caregivers. Avery was the first one to reach out to us as an athlete herself, and that really meant a lot to me. Avery, it really did. And I think that the support system that I had, because I'm big on Facebook, so I was always just looking for the groups and looking for other people I can connect with. And now I have people looking for me from Turkey and Canada, and it's exciting to be able to try, how to tell my story, tell our story.
Elijah, do you have anything you want to say?
She covered most of it.
Love
I
how
mean,
you guys speak for each other.
yeah. I
speak for him.
She does. Nah, just kidding. I'll say for like the newly diagnosed, I'll say to kind of look for the support groups and just kind of talk about it. I feel like it's easier to kind of get through it when you have people that could relate to you, you know? So I say kind of look for those support groups. It helps out a lot.
Totally. And I would love to open it up now for any questions from the audience, if we have any.
Can I just ask you a question?
Yeah.
Because earlier you were saying that how coming out of the hospital and then there were all these challenges with the school and everything. So how would you have wanted your peers to respond to you? Like how much, do you want them? You tell me in your words. How would you want them to? Do you want them to be more supportive or just to let you do your things and not to be too involved? Or what's that balance? Because sometimes people can go overboard they are trying to help actually, but I don't know how the child or the person would feel as to how much is right.
Yeah, that's a really good question, and I think that it varies person to person on what they feel they are comfortable with and how much they're willing to share. I would say that generally I'm a pretty open person, and I would have, I think this also just comes with maturity as well. At that young age, I certainly, I totally give my friends grace. They're like 9-year-olds. What do you expect from a 9-year-old to respond when I say I have neuromyelitis optica? If I were my friends, I would be just staring there. So probably just understanding if I say hey, I can't come to this event tonight. I'm really bummed about it. Just giving me that grace, maybe not asking too many questions about, oh, why can't you come? Oh, you should be able to come. Just, accepting the facts that, I might be different than not the person I was before, not trying to make me someone who I'm not, I would say, giving me that space to breathe while also being there for me in case I do need it, or if I'm not looking well, just looking out for me, I guess. Yeah.
Okay, one last thing, only because you're like my little sister, because I get you, because we were about the same age. But I think the other thing to remember with pediatric patients, especially for the doctors and caregivers, is it's that weird fine line. There is a fine line, and it is hard because we're still dependent, but we're trying to gain our independence. And when we lose that independence even more, when we're trying to break out of that during those formative years, it's really, really tough. So I think the best thing to do is honestly to ask the child again, and this goes back to even basic psychology. Do you want me to fix it or do you want me to listen? And sometimes a kid just wants to be heard. We don't necessarily want somebody to start treating us like a guinea pig. And I think that that's something that all of us in this room can identify with. So.
Sorry, one more question for you. You recently switched therapy, and it was a real challenge, and we tried to help you in our own little way. But it's a question maybe to the doctors too. The fact that all these therapies are really only initially available for adults and very difficult to get pediatric patients on the therapy, even if they are aquaporin 4 positive. Thanks, Jill. I know you want me to shut up, but let me just finish my question if you don't mind. Any thoughts on that from the doctors or from Nell,
So, I treat both adult and pediatric patients, and it can be a challenge. I certainly have battled with my fair share of insurance companies, but it isn't too bad right now. Now, for some of these newer FDA-approved agents for NMO, and of course we don't have one yet for MOGAD, it has been a little bit more of a challenge than it is to use some of the older medications like rituximab and mycophenolate in the pediatric conditions. But there usually are ways to get the medications. I think the worst part of that is the time delay. Sometimes we do face more of a time delay because I do have to battle and do a peer-to-peer. And sometimes I wish I could just start with the peer-to-peer. For anybody who doesn't know, that's when your medication is denied, and then we have to write a written appeal to your insurance company, and then if it's still denied, then I have to get on the phone with another MD at the company. You almost wish for those cases I could just start with that and describe the case and give them the data and show them the papers, and we could just skip those few weeks of battle. Unfortunately, that's not how it works. So often I pre-plan for that, which is I try to make sure, particularly with my kids, that they're going to be covered, whether I have to bridge them with steroids or plasma exchange or IVIG. I bridge them with something I know I can get in case it's going to be a battle. Yeah.
I just want to thank all my panelists. Thank you for being here.
Thank you.
Thank you.
Thank you.